Just waiting on somebody to show me.
And good morning once again, and welcome to Education Pulse with Dr. William B. Height. And Dr. Height comes to you every other Saturday with information about what's happening within the schools, within the school system, within the with the COVID, with preparations, with funding, all kind of good information that we try to provide for you within this hour. And we're very pleased and grateful to have Dr. Height share this information with you. Good morning, sir.
Good morning, Cody.
How are you?
As always, how are you?
I'm good. How are you?
Fantastic. We're good as well. We're good as well, and lots to talk about on this show. We have, we released this past week plans to get some of our youngest children back into some form of in-person learning. This week, we also opened 6 regional centers, and so we have young people with special needs who needed to be assessed in person. Those centers have been opened and have just a lot of information to share today. So we have a bunch of guests on the first half to talk about some of our reopening plans, and then the second half really going to talk with 3 students, as I typically like to do, And 3 students are going to talk about things that they've been doing to, even during this time of pandemic, what they've been doing to lift their communities and to advocate and to help and support others. And so lots to talk about in this show.
And I'm going to get out of your way because I saw that lineup. and you've got some interesting folks with, I know, a lot of good information, Doc.
Yeah. So as I indicated earlier, Cody, one of the things that we announced this past week was the intention to return students to some form of in-person learning. And, we've been out since March. And since schools closed their doors in March, we've had the unprecedented work to do to get all children the technology that they needed in order to be successful. We've had to feed children, and we've had to deliver services that were normally delivered during the school day and from schools. And we know that the lack of in-person learning disproportionately harms low-income and minority children more than others. And this means that our most vulnerable children are falling further behind. And so we know that in addition to the escalating gun violence and domestic violence and feelings of isolation, and it all has tragic consequences for our young people, both in terms of their social and emotional growth, and just it threatens their livelihood and their health and well-being. And so returning our children to schools and classrooms safely is a crucial step to helping to restore some familiarity, community, and connectedness with our students. So we're going to begin to safely transition students into some form of in-person learning. This means it's a mix of learning in a classroom with their teachers and learning at home on a piece of technology. We're going to phase in groups slowly and safely, starting with pre-K through 2nd grade students. And Cody, you may recall, this is the same group that we wanted to phase in earlier, and we tried to do this 2 other times, one at the beginning of the school year and then again in November. Both times, because of escalating case counts and advice, or at least messaging from public health departments, we put that on pause. And so one of the things that I think is extremely important is that we now revisit this. And so we want to bring the same children whose families signed them up to return in November. We want to bring those children back on February 22nd. And that means that all staff who will support the pre-kindergarten through 2nd grade students will return to the buildings 2 weeks prior to that. And that's going to be on Monday, February 8th. And that is to make preparations for the return of the students. Pre-K through 2nd grade families, Cody, who chose to remain 100% digital during the selection process in the fall, will be asked to remain digital at this time. We will have a chance, we hope, to have them opt in at a later date. And as this phase, we want to just approach this phase carefully to monitor the health and safety practices that are happening in schools and to evaluate other safety factors before additional students are phased in. And as always, as I've indicated from the start of this is about safety and family choice. And so once again, pre-kindergarten through 2nd grade families who've already chosen to send their young people back, Cody, it's about 9,500 students. And those families who've already chosen, we're going to be bringing those children back on February 22nd. Staff members and teachers who support those students will return on February 8th, just to make preparation. I think it's also important, Cody, to mention that the Pennsylvania and Philadelphia Departments of Health, along with the Centers for Disease Control, have clearly emphasized the importance of having multiple layers of safety in place, such as wearing masks, social distancing, frequent hand washing, staying at home when individuals are sick, and that is with a view towards protecting everyone's health and safety. The science we now understand is clear that when these layers of safety are in place, the risks are reduced significantly. In fact, medical experts from the CDC, they published in the Journal of American Medical Association this past week that preponderance of available evidence from the fall school semester has been reassuring. And they concluded that with proper prevention efforts, we can keep transmission in schools and educational settings quite low. And so with that, Cody, we think it's time to bring young people back. And many individuals are asking, why do this before everyone receives the vaccine? And there are a couple of challenges with that. One, the supply of the vaccines that are being sent to cities like ours, and the fact that there are other prioritized groups in front of educators now, although educators have been prioritized, but there are lots of individuals who are prioritized for those vaccines first. That's one. The second thing is that those vaccines are not mandatory, nor can we make them mandatory based on how the EPA approve the two vaccines. And so therefore, if in fact only 50% of individuals who are eligible to receive the vaccine are taking the vaccine, if we waited until everyone is vaccinated, then that could dramatically extend the time that we would have to keep children out of schools. And so even with while we want the vaccines to be available for educators, it is not a condition for returning children to schools as long as we can assure families, staff members, students that we're going to have all of those other safety protocols in place. And at every school, we have done the following, and will continue to do the following. There will be pre-screening requirements for students and staff, including testing, Cody, PPE for staff to support mandatory mask wearing and facial covering, PPE for students and staff, I should add, classroom and bathroom setups to promote social distancing, plexiglass partitions in offices and in some parts of classrooms, touchless hand sanitizer stations in hallways, hydration stations that are hands-free, water access, safety signage throughout the school, and enhanced protocols using EPA-approved cleaning products. And so we have done a lot, and I want people to visit our website at philasd.org/AES, and then they can see all of those safeguards. In addition, Cody, we've also done a lot of work around ventilation, and I would say about 200 schools in the Philadelphia area are now open, and many have been open since the fall. These are not School District of Philadelphia schools. These are Catholic schools, private schools, some different charters, and we have a lot of child care centers that have been open. But we are also taking the added step at the School District of Philadelphia to ensure that proper ventilation is in place. We've completed ventilation assessments in every school to assess airflow, and which will inform safe occupancy levels for each room that would be used. And so ventilation systems are being repaired as needed to provide airflow in areas that do not meet those standards. And so we know that lots of individuals are concerned about this, but nonetheless, we think it's really important to get our young people back into schools. And so with that, I want to introduce some of our guests. I know one is on the phone, and well, I'm going to introduce all three, and then we'll talk to each one individually. But first, I'm pleased to have once again back on the show, Cody, the chair of the Education Committee, Councilwoman Maria Quinones-Sanchez of City Council. And so she's going to be joining us via phone She's on the phone already, but I want to introduce the other guests as well. Two other individuals who have been on the show before, Dr. Barbara Clark. Dr. Clark is our medical director at the School District of Philadelphia. She is a licensed pediatrician as well as a former teacher. We also have Dr. Evelyn Nunez, who's also been on the show, and Dr. Evelyn Nunez is our chief of schools. And so she actually supervises those individuals who support principals and really focus on things that are happening in the schools. So we'll talk to each one individually. I want to start with Councilwoman. And Councilwoman Quinones-Sanchez, good morning to you. Thank you for being with us this morning.
Good morning, good morning, good morning, Dr. Hyde. Thank you so much for having me.
Fantastic. And I know that you have indicated as the chair of the Education Committee why it's so important, particularly in your community, to get young people back into schools. And you've emphasized that it has to be done safely and adhering to guidance of all of the professionals and following the science. Can you talk a little bit about that this morning, why you are so engaged, not only as a councilwoman, but also the chair of the Education Committee, and why this is so important to you?
Well, Dr. Hyde, as I've always said, and I'll keep repeating it because I think it bears repeating, the reality is I represent some of the most impoverished, challenged neighborhoods in the city of Philadelphia, and I know and I see that many of our children are the safest when they're in schools. They eat on a more consistent basis when they are in schools, and some of our children can only learn in the kind of educational settings that are provided by schools. And so I let that be the guiding principle, and absolutely want to support all of the stakeholders who have to be part of the family that welcomes kids back to school. So the question is not the no, it's sort of like, how do we do this and get the buy-in, not only from the stakeholders who have to be in the building, but from families. And, the Black and brown communities, my community, our communities, through this COVID pandemic have suffered in many different ways. The numbers bear out, but, we continue to have a challenge with getting folks to trust, right, that we're ready for this. And I think it's important that as someone who lives in this community, represents this community, went to public schools, that I add my voice as, not only as a parent, former parent, but a grandmother, and just someone who is very much aware around these challenges. I also understand that as a public servant, we have a responsibility to make sure that we are adding our voices of concern and ensuring that we are not doing this without help in the science behind it. And I think, again, this is where we follow the statistics, and I'm very much aware of the positivity rate in communities that I represent, some as high as 30%. I'm very challenged with that, and we'll continue to advocate for that. But Dr. Hyde, I think, part of our challenge is, and this is our third attempt at this, right? This is not the first attempt. This is our third attempt. And during these conversations, every time we learn. We watched New York. I was just watching a report from Las Vegas and the number of suicide children that they've had there. There's so many different things impacting our children. And so I think for all of us, we want to see kids back in school, and we want people to feel comfortable with that all of us are watching how this process goes. And I keep saying, we're going to listen, right? We're going to continue to listen. I appreciate you, Dr. Hyde, and your team for the openness to listen and hear the feedback and do whatever is necessary to make people feel comfortable.
Yeah, no, I really appreciate that, Councilwoman. And then could you talk just very briefly on what we have been doing together? And what I mean by together, school district along with the chair of the Education Committee, and how the support, not just the support, but the guidance and the recommendations from the members of council who serve on the Education Committee are guiding that work.
Yeah, we have very committed council members. As you know, this was the first year I became chair of education after Councilwoman Blackwell for 20 years, and I knew it was going to be a bumpy ride. I didn't know I was going to get COVID and everything else. So I'm still adjusting to this additional full-time job. I have a lot of respect for the volunteers who serve on the Board of Education and all the folks. This is a lot of very hard work, making decisions that impact people's lives is very serious work. But the Education Committee has and will continue to meet with the executive team at the school district. We've maintained constant communication. I know that, council members have asked hundreds of questions, and your team has provided hundreds of responses. And we appreciate that, because ultimately the school board is the first place that parents and stakeholders go for accountability. That is the policy board. But as a funder and as part of government, they also come to us. And one of the things that I was very clear about when I took this challenge to chair this committee is that we don't have to agree on policy, but we do have to have the data correct, the facts correct, and then we can debate it, right? And I tried to create a forum and a space where every question gets answered, and I appreciate the fact that the team understands that we have a responsibility to be open and transparent as much as possible with what we're doing, right? And this is very nuanced work, and we don't need our parents to become education experts, trauma experts, but that we need them to feel comfortable that we have the experts around the table and that the debate and the accountability is there. And so, again, this is work that we have to do together, and the members of the Education Committee, as well as the rest of City Council, has been looking, and we will continue to do that. Last week when we had our biannual meeting as required by the law, there were a lot of questions and a lot of concerns, but clearly everyone committed to, we got to get back in schools, and we got to figure out what the new normal is, as we've called in council, because the old normal was not good for Black and brown people, but what the new normal becomes and how we influence that so that we can take care of our young people.
Yeah, no, thank you so much. And thank you not only for what you're doing around this, but thank you for taking on the Education Committee, which you said that was chaired by former Councilwoman Blackwell for many years. And thanks to all of the City Council for their continued support in this work and for helping us to also communicate all of these things that we are trying to do in response to, in many cases, questions from council members and their constituencies. So I do appreciate you, Councilwoman Kiona Sanchez. Thanks for getting up on the side. Thanks for coming on a Saturday to talk a little bit about our work together. I want to transition. Yes. Yeah,
can I just one real quickly, because I know I'm going to be
sure.
logging off soon, but I just, so this morning I received an email from the stakeholders of the Julia de Burgos community, and they're doing a memorial service for our very loved and appreciated. She was a towering figure, and I say that with a lot of love. Principal Marissa Hernandez from Julia de Burgos. And so I just wanted to take this forum. I know many of the constituents listening are educators, either her friends or her colleagues or potentially some of her parents. So the Fairhill community today at 2 o'clock on the 4th Street side of Julia de Burgos is going to have a celebration of life for Principal Marissa Hernandez. And I just want to, again, send my condolences to the entire Julia de Burgos family. A lot of the principals, as is Evelyn and others, these are not just, folks from the community. These are my friends. Some of these folks I went to school with, some of the principals, the Carriones and some of the others. And this is very personal to me, and I respect the work that they do and have learned to see and understand their perspective. And Principal Hernandez, again, all 4 feet of her was incredibly loved and respected in that community, and she will be missed. So I just wanted to take an opportunity to just thank the entire family and the Julia de Burgos family for taking a moment to celebrate her.
I concur, Councilwoman. I know you and I have been at de Burgos together along with Principal Hernandez, and so our condolences as well. We did an acknowledgement of her to the staff and to her colleagues across the district a week or so ago. And so thank you once again, and thank you to the de Burgos community for recognizing Principal Hernandez and her tremendous work. So with that, Cody, I think we're up against a break, and after the break, I want to bring on Dr. Barbara Cluck and Dr. Evelyn Nunez. They're going to talk a little bit about what individuals can expect in terms of layers of protection at the school and the types of things that children will experience when they return to schools. And so we could do that after a quick break.
We'll be right back. Stay tuned.
Did you know you can use LIHEAP to pay your PICO bill? Last year, PICO customers received almost $17 million in free LIHEAP support. This year, take advantage. This deal is first come, first served. Apply now. Call 800-34-HELP-4.
This is not a fad for us.
We will not resume our regular programming when things die down. We're not black to help our bottom line or because it's politically correct. We're not joining a fight. This has been our fight, our message, our people. Black lives have always mattered here. We are
Undeniably,
indefatigably, unapologetically, permanently black. Talk Media.
WURD.
Wake up and text. Text and eat. Text and meet up with a friend you haven't seen in forever.
Hi.
Oh, hey.
Text and complain that they're on their phone the whole time. Text and listen to them complain that you're on your phone the whole time. Text and whatever. But when you get behind the wheel, give your phone to a passenger. Put it in the glove box. Just don't text and drive. Visit StopTextsStopWrecks.org. A message from NHTSA and the Ad Council.
You're listening to WURD Radio, 96.1 FM and 900 AM WURD, independent black media.
And we are back with Dr. Height and Education Pulse. And Dr. Height, you got it.
Thanks, Cody. Our next guest is Dr. Barbara Clark, and Dr. Clark is our medical director at the School District of Philadelphia. She is a pediatrician and a former teacher, just happens to be a former teacher. And I shouldn't say a former teacher because once a teacher, always a teacher. But Dr. Clark, thank you for joining us this morning once again. And can you talk a little bit about the layers of protection for children and staff once they start back?
Absolutely, and you've done a great job, Dr. Height, of talking about that already, but I just want to reiterate how it came about to think of those things. So we have truly thought about your child from the minute they wake up in the morning, how they are going to get to school, what happens when they walk through the door, what happens when they walk down the hallway, what the environment of the classroom looks like, where Dr. Nunez has done a lot of thinking, and what happens when they have to transition between classrooms, which we are really trying to minimize. So again, as a parent, teacher, and physician, putting all those things together is what we've thought about. So the layering starts as we talked about, and each layer provides an extra layer of support, just like you're a lot warmer when you wear several layers of clothing, and not just one will do the trick. So for example, as you all know, everyone in a school building will need to wear a mask. We are staying distance 6 feet at all times. And also the most important thing before we even get to that is hand hygiene, because what I continue to state is the way this virus gets into our body is through our mouth and our noses. So no matter what we do, hand hygiene has to be the first thing. Some other viruses you get through food or drinking, water from a pond. So think about that entry. This entry is through your mouth and your nose. So hand washing is the first thing, and masking helps us even to remember to keep our hands away from our mouth and our nose. But think about it as a layering of a cake at every point. Even on the school bus, there's going to be distancing and there's going to be mask wearing. And then when you get to school and you come through the door, there's going to be distancing and mask wearing. But again, let's back up, because to be honest, I forgot to say, every morning, even before you're at that bus stop, you as the adult needs to look at your child and say, is my child well enough to go to school today, both for their own health, because we all know that rest helps us to get better faster, and also for the health of their school community. So they need to not have a fever, and they need to not exhibit any of the following symptoms: cough, vomiting, diarrhea, shortness of breath, or anything like that. And again, the ultimate COVID symptom, which is loss of taste or smell. So even when you get up, before you send your child off to even get dressed and have breakfast, you have to start there. Then on the school bus, we're masked and distanced. They go through the door, they're masked and distanced. Going down the hallway, I need some water. As Dr. Height said, there's going to be automatic water dispensers. In the classroom, Dr. Nunez and her team has worked hard on distancing of the classroom and minimizing transmission of germs through sharing of supplies. So let's think again about those layers, because they all come into play. And so we have the hand hygiene, we have the screening, we have distancing, and we have mask wearing. And also there are two other things that are part of the layering and aren't the final answer, and that is testing, and also, as Dr. Height talked about, vaccinations. Now that doesn't mean once I'm vaccinated, I get to do everything else. And so again, what we need to remember is this is all layering. So I've gotten a lot of questions about the following. Okay, Dr. Clark, that sounds great, but my student can't wear a mask, or I'm afraid about my student not keeping a mask on continuously. So again, if you think about the analogy of a layer cake, where some of the layers are thicker than others, the cake part is thicker, the icing is thinner. Think about you, the adult, as the one who can be the thick layer of the cake. And sometimes students may have to be a little bit of the thin layers and not be able to do all of them. For example, if you have a student who cannot fully wear a mask at all times, I'm going to thicken my layer as the teacher by wearing both a mask and a shield, okay? Because now I've done the same thing. I'm double dutied up, like a belt and suspenders, because my student cannot do that. So in sum, we've all been thinking about this for a very long time. We've, again, have been educators and healthcare workers working together for your students and for you as teachers. No situation is perfect. We've had to weigh every risk and benefit. Going, you know, as a physician, I think about risk and benefits all the time with giving immunizations, giving antibiotics or anything like that. So in this case, it's time to think hard about that and continue to use this layering so we can get back to school.
Thank you so much, Dr. Clark. And then, you know, we talked about that screening, and I talked about screening earlier, and screening both through testing of adults and of children. Can you talk a little bit about the structures or protocols that will be in place for that?
Around testing.
Yes, around testing.
Yes, so all staff members will be tested weekly at school with a test that gives a 15-minute turnaround result, and depending on that result, then there are further recommendations we will be giving. And then in terms of students, that's for asymptomatic staff. That's just showing up at work every week, you get tested. For asymptomatic students, there is going to be a subset of students that will also be tested, who again are showing up for school, just so we can get a grasp of what the burden of the virus is in the schools. As Councilwoman said, it's been shown to not be very high in schools, and in our experience is the same with the non-public schools that have been in practice. The other mission in terms of testing I'm very happy to inform you of is that symptomatic students will be tested by our school nurses who they're familiar with, so I'm very happy about that. I remember my school nurse fondly. And so symptomatic students will be tested by our nurses, and again, depending on the results, a further plan will be, we know the plan, it will be implemented. But that means is defined as symptomatic is, remember, we're pre-screening our children before they come to school. So when they leave the building, when they leave their houses, the children need to not have a fever and not have any of those symptoms we have gotten to know very well. The testing for symptomatic students in the school are for students who all of a sudden around 11 a.m. or 1 p.m. the teacher notices they're starting to put their head down on their desk or just not being as involved, and we've all been in that situation. So it's for students who show sick symptoms during the school day but arrived at school healthy.
Thank you. Thank you so much for that. And I wanted to make sure that we also have time for Dr. Nunez, who I know is also on. And Dr. Clark, I'm going to ask you to remain on just for a few minutes in the event that there are any additional questions that may come from some of what Dr. Nunez will share. But Dr. Nunez, who's their chief of schools, who was just referenced by Dr. Clark. And Dr. Nunez, good morning to you as well.
Good morning, Dr. Hyde. Good morning, Dr. Clark.
And thanks for being here. And to start, can you talk more about what the weekly schedule will look like for students?
Absolutely, Dr. Hyde. The pre-K students that have selected to enroll in the hybrid program will follow a staggered schedule that will consist of 2 days in person and 3 days of digital learning. This schedule was selected to minimize the number of students in the building at one time and to support social distancing requirements. We want to ask families to help support everyone's safety by ensuring that their child comes to school for in-person learning only on the days that they are assigned. Again, we want to ensure that it's a safe environment for everyone, so asking all families to truly support this initiative as we transition and begin in-person learning.
Thank you. And will students have an opportunity to learn from their current teacher, whether they're in person or at home, or are these different people?
As much as possible, this is definitely our goal. We want to ensure that students remain with their teachers that they've had since the beginning of the school year. We've invested in new cameras and speakers and installing them in all of our pre-K to 2 classrooms. This will allow for our classroom teachers to effectively engage students who are learning in person as well as virtually. Other instructional models were explored in the previous months as well, so that we can ensure that teachers who have received an approved accommodation and are unable to teach in person can continue to teach their students virtually as well. For example, we may have a teacher with an approved accommodation who can still teach their students virtually. This will mean that the teacher would teach all her courses digitally, and all the students will log on during whole group or synchronous instruction time. The students who are in school will log on so that they can receive their instruction from their teacher, and they will be monitored at the school by another staff member during this time.
Thank you so much. And this is a question both for you and Dr. Clark. So I just want to know that, so conditions change. They've been changing throughout this pandemic. And conditions change that may require us, through the recommendations of the health department, to temporarily close a classroom, school, or the entire district to help stem the spread of COVID-19. Dr. Nunez, first of all, Dr. Clark, can you talk about what some of those conditions may be? And then following you, I'd like Dr. Nunez to talk about what parents and families can expect if and when that happens.
So we have a great communication and relationship with the Department of Health around the schools and cases that come up. We've had some experience with them with the schools that have been open since September. So we are well equipped to stay informed of students who may or staff who may become positive with COVID, and then do the contact tracing around those people in contact with that student or teacher. So for example, a whole class may be determined to quarantine. Now that may not affect the rest of the school activity, but a whole class may be asked to quarantine based on a positivity of a teacher or a student. So that's basically the first policy and the first step. Then we would be in direct communication with the Department of Health if, God forbid, there was an outbreak where more classrooms within a particular school had outbreaks. Then we may have to consider further closure. We have direct communications with the parents ready and with staff to go if and when these events occur.
Okay.
Thank you, Dr. Nunez.
Yeah, so as you know, Dr. Haidt, safety continues to be our top priority. And as such, we're prepared to use, we're prepared and have a strong commitment to informing parents using all of our school communication tools as needed. In these cases, students will immediately shift to digital learning from home until they can safely resume to in-person schedules. Our school leaders have planned ahead for these circumstances and are ready to support smooth transitions between hybrid and digital learning models as necessary. Once again, parents and families, we're asking to be prepared for this, right? And expect that these are changing realities, and to be flexible and patient as we navigate these circumstances together. So that collaboration, that open dialogue, between home and school it's more important now than ever to ensure that we are supporting each other and understanding that we both need to be flexible and patient during these times.
Yeah, thank you. Thank you both, to Dr. Clark and to Dr. Nunez. Dr. Nunez, one final question for you. We've already received questions about whether students in the hybrid model will continue to have access to grab-and-go meals. We heard from Councilwoman Keona Sanchez early on that it's the place where many children have access to nutritious meals. So will they, and what will the process look like? So if in fact a student is in the hybrid model, will they continue to have access to the grab-and-go meals?
Absolutely, Dr. Hyde. Those students that selected the hybrid model and will be coming to school will enjoy their breakfast and their lunch while they are at school. They will also receive their grab-and-go meals to take home for their fully digital days on the last day of their in-person learning for that week. So for example, if a student is part of the A schedule, which are students that come to in-person learning on Monday and Tuesday, they will pick up their meals for Wednesday, Thursday, and Friday at the end of the day on Tuesday. If for whatever reason a student is not able to take the meals home, the parents can always stop by the meal sites on Friday and pick up the meals as well.
Thank you. And Cody, as you can see, we heard it from Councilwoman Kiona Sanchez that, so this is a third time at this, and we've learned a lot from the other two attempts and from what we've heard in terms of concerns of individuals. And so you could see the level of planning and detail that has gone into this process. And I want to thank Dr. Clark and Dr. Nunez for coming on this morning and sharing some critically important information. And Cody, do you have any questions for these two young ladies before?
Don't get me started, Doc. I got a ton of questions, but it's so interesting. I don't think they left much out, you know, and it's a full program. So at another time, I have a couple minor questions, but I want to move on. You may want to take a commercial break before you transition.
Yeah, so thank you once again to Dr. Nunez and Dr. Clark, and we're going to take a quick transition. I mean, we're going to go to break, and then we're going to transition to students who, even in the face of the pandemic, have continued to do things that are improving their communities, their school communities, and providing support. And so we will return with those three magnificent students that we will talk to after the break.
Mm-hmm. Buying something from a dealer just sounds a bit, well, put it like this. My cousin Ray Ray got arrested for buying something from a dealer. So why would you want to buy your car from a dealer? Hi, everybody. This is Nick inviting you to buy your next car from Jerry over at Cardex. See, they're not dealers. They're like a car concierge service. They design a car around you. Almost any make. If it's not on the lot, they'll go out and get it for you. So use my car concierge, where I've already bought 4 cars. Cardex at 116 East Glenside Avenue in Glenside, Pennsylvania. Check them out online at cardexinc.com. Or call Cardex at 215-886-3230.
Listen to Laborers Live.
We created the weekend. We created the 40-hour work week. We just wanted enough to feed our family, be able to send our children to college, and let our next generation do better than we did.
To people that might have forgot how important unionism is in a country like the United States. People now infringing on our 8-hour workday, trying to work people more than 8 hours without overtime, trying to work people without benefits. In the long run, everybody's getting fat paycheck except the worker. So this is really a wake-up call for America.
The struggle is continuous. Tune in to Laborers Live every Friday from 4 to 5 p.m. Sponsored by LESIT, the Laborers Employers Cooperation Education Trust of the Laborers District Council of Philadelphia and vicinity.
Local 332, Sam Staten Jr. Business Manager. Local 57, Esteban Vera Business Manager. Local 135, Dan Woodall Jr. Business Manager. Local 413, James Harper Jr. Business Manager. The Laborers District Council, Ryan Boyer Business Manager, and Tony Staten, Executive Director of LESIT.
America's kids are returning to class, in school and at home. And this year, learning is especially tough on students who already struggle with poverty, emotional trauma, and other barriers.
That's where our organization, Communities in Schools, can help. For years, we've had caring adults inside schools, helping these students stay in school.
And now, we are taking our work beyond the school walls, tutoring, mentoring, and counseling students, providing resources for at-home learning,
delivering meals, providing household supplies, connecting kids with online classrooms, and using technology to maintain the one-on-one relationships we know can transform the lives of students and their families.
We are doing whatever it takes to make sure all kids have the opportunity to learn and succeed.
Communities in Schools, going wherever we are needed to help those students who are most in need thrive.
To see how you can help kids succeed, visit communitiesinschools.org. That's communitiesinschools.org.
You're listening to WURD Radio, 96.1 FM and 900 AM WURD, independent black media.
And we are back. And Dr. Height, I got to tell you, you're answering a lot of the questions that I had wanted to ask. So you're doing a great job with these interviews. You're pulling out a lot of great information. So I'm very pleased to, and I'm certain the audience is too, to get all of this great information.
Yeah, it's one thing we're trying to do, Cody, give as much information out as possible. And we know it's a lot, but we also get a lot of good questions from listeners and from other individuals like city council persons, city council members who hear questions from their constituents. And so we are trying to put as much information together to respond to those things, whether they're being asked directly or indirectly. So I appreciate you acknowledging that.
Mm-hmm.
We have now 3 young people, and Cody, these are young people, and we're always trying to feature young people on this show, at least, because we are the School District of Philadelphia. It represents the future of Philadelphia. But once again, you're going to see, and I think you've met maybe 1 or 2 of these young people before, but you're going to see once again why it's so critically important to be focused on the efforts of the students and what they are accomplishing in the face of like an enormous, well, a significant challenge, and the challenge being the pandemic, the racial injustice stuff, all of the things that are happening to young people being in a virtual environment. And so with that, I wanted to feature 3 young people today, and those individuals are Araya Clay, and she leads a peer mentoring program. Araya leads a peer mentoring program at Edison High School. We also have Shayla Street. Shayla Street is the co-founder of a nonprofit, Philly Black Student Alliance, and Shayla is a student at Central High School. And Akayla Brown, and Akayla is the founder of nonprofit Dimple for Days, and she is at Bodine High School. And so want to start with Araya. And good morning, first of all.
Hi, good morning.
And Araya, I know you lead the peer mentoring program at Edison High School, and you have been doing a great deal of mentoring with freshmen and sophomore students at Edison. Can you talk to us a little bit about the experience and what that means to you and what that means to those who are being mentored day in and day out?
Sure. So at my school, I, as you said, mentor 9th graders and sophomores. I am a high school senior. Basically, I just help them through 9th grade, and I help them through high school. I reassure them that, you know, high school is going to be bumpy, it's going to be tough, but you can get through this, especially in the pandemic that we are in right now. What that means to me is it leaves me with this bubbly, this good feeling, because I love helping people. And growing up, you know, I had a lot of people around me help me, you know, to get to where I am right now, like people in my house, school, just my community. So it really means a lot to me that I can give back to my school, especially in the community that we're in. I have a really little tough community. So I feel like it's really beneficial for my school that I could help them in any way that I can, you know, whether that's financially or just me shedding knowledge as a high school senior who's been through that school for 4 years.
Really appreciate that, and really appreciate your perspective and the work that you're doing to assist others. You said you're a high school senior, Araya, so congratulations to getting to that point.
Thanks.
But what do you plan to do next year?
So next year, I plan on going to a four-year university. I believe I wanted to go to Indiana University of Pennsylvania because I want to become a lawyer. That's going to be fun because I like to help people, like I said. So being a lawyer can help people get justice, because I always, you know, see injustice around all over the world, and it's heartbreaking. So in the future, I want to become a lawyer so I can extend my help even further to a wider crowd than 9th graders and sophomores. You know, me being older, I realize I have a lot of power behind my voice, and I just want to be able to use that. So definitely.
Beautiful. Have you heard anything from Indiana University of Pennsylvania yet?
I actually got accepted in there recently. So yeah, I did. And I got an academic scholarship from there as well. So, you know.
Congratulations. Congratulations to you. and we're proud of you. And want to move. Thank you for joining us too, by the way, on a Saturday morning. Like, you don't have other things to do on a Saturday, but thank you for joining and talking about your experience. The next student is Shayla Street. Shayla is a co-founder of nonprofit Philly Black Student Alliance. She and is a student at Central High School. Shayla, good morning to you as well.
Is Shayla there?
Is Shayla not there? So we'll come. Okay, so we'll come back to Shayla if in fact she comes on the line after momentarily. So want to then introduce the listeners to another young person who's doing incredibly important work, and that is Akayla Brown, founder of the nonprofit Dimple for Days at Bodine High School. Akayla, you've been working. Good morning to you first and foremost.
Good morning.
You have been working hard with your foundation, Dimples for Days. Talk to us a little bit about how significant your work has become over the last year.
Okay, well, again, hello everybody. I am Akayla, and my nonprofit name is Dimples for Days, so like dimples plural. Over the last year, you know, it's been a little hard. I'm still working, but it has been harder. Usually I do an annual book bag drive. Considering that COVID happened, we were aiming to give away 1,000 book bags to the community because the year before that we did 500. We tend to double it. We weren't able to do that. But while we have our downfalls, every setback comes with a greater comeback. COVID hit, we were able to still get in the community and hand out personal resources, hygiene products to the people around the community. My little sister was still able to launch her own program called Royalty East, where it's empowering young girls, teaching them the importance of how to talk to each other, how to communicate, bringing them in. And then recently, I was able to kick off my own workforce development program so that I would be able to incentivize youth for learning about the workforce development program. And then at that, as soon as this interview is over, I literally have to run to my youth entrepreneur pop-up shop. So I'm working, I'm making sure that the youth are being heard, I'm making sure that the youth are standing up, I'm making sure that through all of this whole COVID pandemic, the youth and the community in Philadelphia are still going to be able to push through. They're going to still be able to power through, and we're going to, you know, go with the flow, but then still remain on top. So that's how everything is going with us.
I appreciate that, Akayla. And I know that, and Cody, you have met Akayla before because she also was very instrumental in doing the session that we had with the gun violence.
Yes.
And so Akayla was very instrumental in also doing that. And you could hear at least three, I think I heard 3 foundations in there or nonprofits in there, Akayla, between you and your little sister and the work that you've been doing. I know you're a senior as well. What are your plans for next year?
I definitely want to go to college. I'll let people know on decision day which college it actually is. But whatever college I am going to, I just wanted to make it known that my nonprofit will be coming with me. My life's mission is to be a philanthropist. I literally live off of benefiting from the other, like from helping other people. That's just what I do. That's how I am. So that's my life now. Next year.
Uh-oh. Think we may have lost you a little bit. Unless the other one just tuned in.
Yeah, I'm like, I don't think that was me. I'm sorry.
That's okay.
That's okay.
Here, but then for like prolonged, yes, it would be definitely dimples for days everywhere.
Dimples for days.
Dimples for days, Akayla. And Akayla, thank you. And I know that you and I have had several conversations in various meetings, and you have been one that has always advocated for young people to be a part of the solution. And so I just want to thank you. And I know you said you have to rush off to another meeting. And
I'll be here for the whole interview. I'll be right at my pop-up shop, yes.
Okay, fantastic. And I know Shayla just joined, and Shayla is the co-founder of the nonprofit Philly Black Student Alliance. And Shayla is also a Central High School senior as well. And Shayla, you are a co-founder of the Black Student Alliance in Philadelphia. Can you talk to us about the work you all have been doing over the last year? I know Shayla just joined. I saw her.
We're not getting sound from her. Yeah, okay. I see her as well. We're not getting your sound. Try it again. Okay, we're not getting her, Doc.
Okay, so then what we'll do, and I'll give both, if Kayla, if there's anything you want to leave us with, here's your opportunity, and Araya, I want to ask you.
Okay, if Araya, is Araya right? Yes. If Araya doesn't want to go, I will definitely just say this. Like I said, like you said, I've been on here multiple times. I've talked multiple times. My whole thing is youth are the solution. While youth are the solution, that does not undermine the fact that we don't need help from our guardians, from the people inside of the district, from just other people around. Like, for example, my workforce development program, there were 50 spots to be filled for youth to come in, be able to do resume building, learn the importance of, communication, get apparel for when they had to go out into the actual fields, all being compensated. I believe that we sent it to multiple principals around the district. And I mean, yes, we filled our 50 spots up, but it shouldn't have been that hard. It should have been people pushing it, how they will push anything else. When they want us to do a survey, they're pushing it. They're offering that extra credit. So there's a lot of youth entrepreneurs inside of the Philadelphia School District, and I would just like to highlight that. A lot of them are going to be at the pop-up shop today on 925 North Broad Street, if any of you want to stop catching.
She's good, Doc.
North Broad Street.
She's good, Doc.
She's amazing.
A lot of them are going to be there, though. A lot of the youth entrepreneurs inside of the Philadelphia School District will be present in there. And it's just like, without that support from like the people that are older than us, our old heads, as y'all would like to call yourselves to us, it's like, yes, we'll still go far because we have each other, but just how far we'll go. Oh, Shayla, we hear you now.
Oh.
Just imagine how far we would go if like everybody was one, if the community was supporting our young people too, rather than just always pointing out when they're doing wrong. Good thing you guys are talking to us today, talking about how we're doing good and what we are doing in the community. But now it's time for us not to just keep speaking on it, but us to act on it too. So I hope to see some faces at our pop-up shop. But even if you're interested in a workforce development program, you could contact me on my nonprofit page at Dimples for Days, or even my personal Dimples 0978, and the ages are 16 through 24. So thank you.
You are welcome, Michaela. Thank you. And I think we have, and Araya is on the phone. And Araya, sorry, I was mispronouncing your name, but I think we have Shayla on the.
Yes, can you hear me?
We can hear you.
Okay.
Shayla, you probably have 1 minute to say hello.
All right, I'll go. That was perfect. That was a perfect segue. So basically, that's how we got started. Basically, we were tired of talking to people and we wanted action. So we crafted student demands of our administration and also of the district. We protested in front of the district with the racial organizing committee. And some things in these demands were like the director of equity and inclusion, which thanks to the district, we were able to get after, testifying at a bunch of board meetings. And, that's what we do. We try to bring the energy to the board meetings, and we want more people to testify, and that's some of the things we do. So in our demands, we wanted more Black teachers, and we wanted students to be a part of the hiring committees, and not just at Central, but this is something that we want district-wide, and I'm hoping that this will happen. But at Central, we were able to serve on the hiring committee of the director of equity and inclusion. And that person is working hand in hand with us, like the Black Student Council, to get things, to implement things and to work with the principals. Like right now, we're trying to get more Black students into these magnet schools. And so I'm president of the National Honor Society. So I'm working with those students who are like at the top of our school to tutor and mentor other students on like the PSSAs, like the 7th and 8th graders at like Wagner, Logan, other schools around Central who are not, maybe they're not meeting that PSSA requirement or whatever. So we do a lot of work. I also worked to get the vote out, and we registered hundreds, almost thousands of people this summer. And we also have a voter registration policy, which we sent to the district, and we're hoping that can also be something that's implemented, because although, we were pretty successful registering students, this is something that, every school should have, and it shouldn't be on students. Like, we can participate, but it should be something that's mandatory. And so also something that we stress in PBSA is that although there's racism and stuff, Black students shouldn't have to bond over trauma. Like, we should just be able to be. So we're like, for Black History Month, we have a bunch of things that we're organizing. We're doing African dance. We're having a Black business affair, Kayla, if you want to slide. So we have a lot of things going on, and we're also working with Black Lives Matter Philly. And when everything happened with Walter Wallace, when that occurred, you know, they reached out to us, and we got together and we had a.
We're out of time, young lady.
Excuse me?
I said we're out of time.
Okay.
I'm so sorry, too.
Obviously, we're doing a lot. I can't even tell you guys everything, but this is the problem also with virtual learning. You see, this happens during class. Some of my peers haven't even logged on, and that's a problem. So I'm hoping that everything, that this in-person stuff, you know, it's safe, but we get it going because, you know, a lot of people at the board meetings are the people who know how to log on to Zoom. And some people who, you know, don't know how to log on to Zoom aren't even testifying. So you're saying you want to hear more diverse voices, but, you know.
We're going to have to have you back, young lady.
Sheila, we'll bring you back. We'll bring you back, Sheila. I promise. All right.
Doc, you had some great folks on today.
Indeed. So much so, Cody, that we ran out of time. So I just want to thank you as always.
And, Doc, I want to thank your executive producers, Evelyn Sample Oates and Hania Sharp Brown, for a great program. These young people give you hope. I enjoyed listening to them.
Indeed, they do.
Thank
all
you.
The time. Thanks. Take care.